Okay, so you went with your brother to fill his prescription, and I asked you to film the interaction, and the prescription was from Dr. Retired from St. Pete's, and I wrote for John, your brother, the very same prescription.
Exactly.
OxyContin 30 milligrams twice a day, and oxycodone 10 milligrams a couple times a day, and or 4 times a day, I guess. It was the very same prescription for a couple of years.
Yes, several years.
And then, because of the policy and the recommendation, who you saw at the hearing, and she said that patients should keep one pharmacy, we elected to send John up. It's the exact same prescription. Then what happened?
Well, we got there, and the cashier walks up to my brother and she looks at it, and then as soon as she sees who's it from, she says, "We can't fill this." And I ask, "Why not?" The pharmacist then walks over, and the only explanation that they would give me for not filling my brother's medicine, who has been there for at least 4 years with them, and has filled all his medication, all of a sudden that day they couldn't fill his medicine because they don't like Dr. Ibsen there. And he was very arrogant. He told us that he refuses to fill anything for you, even though it's the same prescription. I informed him that John gets this monthly. There's no changes to it. He said it doesn't matter, that because it came from you, he will not fill it. And I had the phone in my hand. I did try to film the thing.
Okay, one more. You had the phone in your hand?
And I tried to tape it. He got very ugly about me trying to tape it. And he just told us that basically we needed to leave because he didn't want to deal with us. And like I said, my brother, the only reason we went there is because my brother's been there for all these years since he's been here in Helena.
And he said you need to leave. Like, did he say security was coming?
Oh, no, he didn't say anything like that. He just said we need to leave because I was very argumentative because I don't understand why your name being on the same prescription that he fills there every month like clockwork. And
he had a quality issue with my services, or what was his problem with
the only thing he can tell me that he wouldn't fill your prescription for my brother was because y'all had a conversation on the phone one time, and he didn't like the attitude that he encountered with you. And so therefore he will not fill any prescription from you for my brother, for any other patient at all. That no Dr. Ibsen patients are allowed to fill at St. Pete's Pharmacy now. And that just, like I said, is...
But he didn't have any problems with my quality as a physician. When you said, "What's the matter with Dr. Ibsen?"
No, he couldn't tell me if anything was wrong. Because I said, like, what's wrong?
He said I did something illegal. What was the illegal thing?
And the illegal thing he said was that, he said that you were committing some type of illegal activity by faxing over the prescription first. And I asked him, I said, "Why is that?" I said, "Dr. Griffin does the same thing." And he says, "No, we cannot fill a fax." And I said, "No, you can't." I said, "But here's the hard copy." I said, "He does this to ensure that none of the patients get a hold to the script and change information on it. The only reason he sends that to all pharmacies is to make sure that nobody tries anymore to get over on him and change any information on the script." And I said, "That's the only thing he's doing, is letting you know up front, I'm sending this guy in, he's coming to pick up his medicine, and this is what I'm giving him. But you cannot fill it, I understand that, until he gets there and gives you the hard copy."
The unaltered.
The unaltered copy. Yeah. And as long as it matches with the facts, then there's no problem.
And what did he say at that point?
He said that it was illegal for you to do it, but it wasn't illegal for Dr. Griffin to do it.
Right.
And that's all he could tell me.
Like more than one standard, apparently.
Exactly. Yeah. Okay. It's like it's a personal vendetta against you.
Right.
That's how I took it.
Which has you and your family suffering.
Very angry.
Yeah.